Dr. Orchid, I'm an orthopedic surgeon, board certified. We'll talk about what that means maybe in another episode. But anyway, we're back here as the rotator cuff expert. Today we're going to talk a little bit about rotator cuff. Rotator cuff gets really confusing, and there's lots of terms that people have a hard time understanding. So we're going to try to go through that understanding today. So the first thing, what is the rotator cuff? And so sometimes people don't quite get that word right? Sometimes people will say rotor cuff or rotator cuff or rotor cuff or rotator cuff, all those things. So when we talk about the rotator cuff, first, most basic thing is it is rotator because it helps rotate the arm, cuff because it's a cuff of tissue that goes around the ball. So if we look at the ball and we look at the rotator cuff, it cuffs just like a cuff around around your arm. It helps stabilize the ball and helps rotate the ball. So what is the rotator cuff? Well, it's sort of, some of it's important, some of it's not important. It's important as an orthopedic surgeon to understand, but some of it's not really that important as the layman is to understand. And so there's lots of information out there for rotator cuff. As far as for surgeons, there's less information out there for people who just want to have a general understanding of the rotator cuff. If we are looking at the rotator cuff, so I'm going to use a little multimedia today. We're going to try this. I'm probably not going to be very good, but I'm going to try it anyway. So this is a picture of the shoulder. So this is the ball called the humerus. So this is the ball is actually in here. This is the bone that comes across here called the clavicle. This is the bone that comes around over the top here called the acromion. The acromion becomes, if we look at the back, it becomes the back of the shoulder blade. So this is the shoulder blade. And so what you feel when you press the back of your back around the shoulder blade is the spine of the scapula. And so if we look at the muscles of the rotator cuff and the tendons of the rotator cuff, we have one that's above the spine, we have one below the spine. That's called a supraspinatus and an infraspinatus. If we look on the front, we have another one called the subscapularis, which is underneath the scapula. That's why it's called sub. There's one other one down here on the back side called the teres minor. All this is not really that important. So the important thing is there's 4 rotator cuff muscles to tendons. Tendons attach muscle to bone. That's why it's a tendon, not a ligament. Ligament attaches bone to bone. Anyway, I digress. So there's 4 tendons, but there's also lots of numbers and names and things that get confusing, okay? So I'm going to use my whiteboard in just a second, but for right now, let's talk about the rotator cuff. What is the most important tendon? The most important tendon is the supraspinatus, above the spine. Why is that so important? That's the one that 90% of the time is the one that gets injured. Now, sometimes you get a supra into the infra, but let's just talk about the supra is one that gets injured the most. And we're not going to talk specifically about rotator cuff tears today. We're going to talk about something else, all the other stuff that is before tears. So people talk about tendinosis, tendinitis, bursitis, impingement. Those are the things that make people crazy because we don't even understand what that means. So when we look at the tendon, that, again, this is the supraspinatus tendon. If we look at the tendon can have some problems inside it. And that would be an irritation or growing old, so to speak. So irritation would be tendinitis. Growing old or having some imperfections in the tendon itself, not really a tear, but some imperfections would be tendinosis. And then we talk about bursitis and impingement. So in 1 second, I'm going to switch and we're going to look at the screen behind me. We're going to talk about what the difference is between all those things and how it makes sense in the anatomy. Okay, so here we are back at our drawing. Again, we talked about rotator cuff, rotor cuff actually should be rotator cuff. That's cuff tissue. And then we talk about tendinitis, bursitis, impingement. And so when we look at this nice little drawing that I made right here, this is from, if we're looking at it from the side of the shoulder. So if we're looking at it from here on in. So this is the front of your shoulder, this is the back of your shoulder, this is the ball and socket joint. So what we see is there's sort of like a house of tendons around your rotator cuff, around your ball. The front is the subscapularis, the top is supraspinatus, the top back is infraspinatus, and the back is teres minor. So right here, as we talked about before, this is the supraspinatus. This is the one that gets pinched the most. And this is the one that gets damaged the most, diseased the most, one that we have to talk about the most. So if we're talking about a rotator cuff tendon that is the most likely damaged, rotator cuff supraspinatus. So hopefully that explains a little bit. Now, if we look at this picture here, we're looking at the ball, we're looking at the socket, we're looking at the tendon coming across, and it attaches to the outside here, called the greater tuberosity. That's not really important. It attaches here. So you can have tendinosis inside the tendon. You can have bursitis. This is a little sac of fluid on top of the tendon. That little sac of fluid on top of the tendon helps it rotate and move underneath this bone, the acromion. So you can have the bursitis. You can have tendinosis or tendinitis. And then you can have impingement. Impingement means when you move this arm, this hits this. This is a spur. The spur of the acromion. The acromion is this one here and this one here. Doesn't really matter so much, but the acromion is what comes up around over the top from your shoulder blade. It's the spur here. It can pinch the bursa, called bursitis. It can pinch the tendon, called tendinitis. And so that's what all these terms mean. Tendinitis, bursitis, impingement, spur, supraspinatus, all confusing, but hopefully all understandable now. We're going to go back so you can see my beautiful face in 1 second. Okay, we're back. So you say, okay, that's all well and good. I get it. I guess it's sort of complicated, but I think I understand it now. But what does that mean? The key thing is what it means is it hurts, right? And it hurts because of the pinch. It hurts the tendon. And so sometimes we can't tell as orthopedic surgeons whether you have a true tear of the tendon or you're just having one of these bursitis, tendinitis, tendinosis, impingement, those kind of things, okay? So sometimes we need to get an MRI to determine that. And so we'll talk about MRIs and what that deal is all about. But if you have pain in your shoulder and you hurt, especially when you reach back behind you, it most likely is a rotator cuff problem. The key thing is go see someone who knows what they're doing, right? And that would mean an orthopedic surgeon. Most orthopedic surgeons should be able to at least initially start down the road of shoulders, but go see your orthopedic surgeon, preferably someone who's board certified. And again, we'll talk about that, but you can BCBE, board certified, board eligible. We'll talk about that in another episode, but make sure you go see someone who knows what they're doing so they can do a proper exam, proper x-rays, and determine what to do next, okay? So in general, what to do next is, if we know that you have a rotator cuff tendinitis, tendinosis, bursitis, impingement, all kind of the same thing. They are different terms that really mean the same thing. If we do that, what do? Well, we do anti-inflammatories if you can, right? Aleve, Advil, those kind of things. If you can, if it's okay in your stomach and everything else is okay and you're not taking blood thinners, that'll be fine. So that would be the first thing. Rest. Rest specifically means no overhead stuff, no behind you. Don't reach behind, when you're driving the car, reach behind you. That usually is a common complaint of why or how the rotator cuff is irritated with reaching behind you. So that's one thing. And then we talk about maybe an injection of steroid. There's a bunch of different kinds of steroids. People call that cortisone, people call it steroids. We will go in depth with injections of steroids and injection of other things in the shoulder in another episode, if that's what y'all want. And we'll talk about that, how we're going to decide what we want, what we don't want. So injection of something, and then injection under how. So how do we inject it? One is where do we inject it and how do we inject it? Again, we'll talk about that again in another episode. But just quickly, we'll talk a little bit about ultrasound versus non-ultrasound. Ultrasound is not a different kind of injection. Theoretically, it would help us put the injection in the most ideal spot. But if you get an injection under ultrasound or an injection not under ultrasound, it is still the same medicine going hopefully to the same spot. Again, we'll talk about that in another episode if people care. Lastly, well, what if all those things don't work? Well, if all those things don't work, then we can talk about doing surgery, opening up that space, taking that bursa out, taking that spur off, cleaning up if you have a little fraying of the tendon. So those are the things we can do, but obviously we don't want to do that. And the beautiful thing, sort of, I mean, it still hurts, but the beautiful thing is if we have tendinosis, tendinitis, bursitis, impingement, if we have those things, we have a leeway, we have a window of time. There's no urgency to go in there. So we can take as much time as the patient wants, the therapist wants, if we do physical therapy, the surgeon wants. We have time to see if it's going to get better. Sometimes in orthopedics, we don't have time, right? Sometimes we need to get this done or else it won't be fixable. With tendinitis, tendinosis, bursitis, impingement, spur, we don't have to rush. So that's a key concept if we look at what we're talking about today, because we don't have to rush. And if someone's trying to rush you to get this taken care of, then beware. Anyway, go see your board certified, board eligible orthopedic surgeon if you're having these problems. And we'll be back with another day for another episode. Thanks and bye.